Good morning, ma'am. This is Saujanya Emanuelu. I am a nursing student from Adventist University of the Philippines. Now I am here to perform research on asepsis. My topic is the importance of infection prevention for healthcare workers. Infection prevention and control practices are important in maintaining a safe environment for everyone by reducing a risk of the potential spread of disease. These practices are designed to reduce the risk of hospital associated infections and to ensure a safe and healthy hospital environment for our patients, healthcare workers, and visitors. The first thing is hand hygiene. Hand washing is your best defense against infection. Good hand washing means washing your hands with soap and water or using odorless alcohol based hand gel or foam product to clean your hands. We encourage everyone to wash your hands thoroughly at the hand hygiene stations located throughout the hospital and at all entrance and exits. Clean our hands with alcohol based hand rub unless your hands are visibly soiled. Then soap and water is preferred. It is recommended that you perform hand hygiene at the following time. First one is when you enter and leave the hospital. Second, when you enter and leave a patient room. Third one is before eating. Fourth one is after using washrooms. Last one is after coughing, sneezing, and blowing your nose. Next, we will see infection prevention control. There are three precautions. First one is airborne precautions. Second one is droplet precautions. Third one is contact precautions. Now we will see about airborne precautions. First one is visitors. Report to nurse before entering. Use airborne precautions as recommended for patients known or suspect to be infected with infectious agents transmitted person to person or by the airborne route. Next is patient placement. Place in air, that means airborne infection isolation room. Monitor air pressure daily with visual indicators. Next one is keep the door closed when not required to entry and exit. In ambulatory settings, instruct patient with a known or suspected airborne infection to wear surgical mask and observe respiratory hygiene or cough etiquette. Once in an AIR, the mask may be removed. Third one is patient transport. Limit transport to medically necessary purposes. If transport outside an AIR is necessary, instruct patient to wear a surgical mask and observe respiratory hygiene or cough etiquette. Fourth one is hand hygiene. Hand hygiene is according to standard precautions. The last one is personal protective equipment. It's PPE. Wear a fit tested, noise approved N95 or higher level of respiratory protection when entering the room of a patient when listed diseases are suspected or confirmed. Next one is droplet precautions. Stop visitors. It means report to the nurse before entering. First, we will cover PPE. Don a mask upon entry and into the patient room or cubicle. Second one is same like hand hygiene according to standard precautions. Patient placement. If the patient infected with microorganism or something, private room we should put them in private room if possible. Cut off place patient as far away from other patients as possible if private room is not available. Patient transport. Limit transport and movement of patients to medically necessary purposes. If transported or movement in any healthcare setting is necessary, instruct patient to wear a mask and follow respiratory hygiene or cough etiquette. No mask is required to person transforming patient's droplet precautions. The third precaution is contact precautions. Stop visitors. Report to nurse before entering. Gloves. Don gloves upon entry into the room or cubicle. Wear gloves whenever touching the patient intact skin or surfaces and articles in close proximity to the patient. Remove gloves before leaving a patient the room. As well as hand hygiene. Hand hygiene according to standard precautions. Next one is gowns. Don gowns upon entry into the room or cubicle. Remove gown and observe hand hygiene before leaving the patient care environment. Patient transport. Limit transport of patient to medically necessary purposes. Ensure that infected or colonized areas of the patient's body are contained to covered. Remove and dispose of contaminated PPE and perform hand hygiene prior to transporting patients on contact precautions. Don't clean PPE to handle the patient at the transport destination. The final one is patient care equipment. Use disposable, non-critical patient care equipment or implement patient dedicated use of such equipment.